mother brings her 2-year-old son to your office after she noticed a sore on the back of his throat. She states that her son had a fever and was complaining of throat pain 2 days ago. The child has also been fussy and eating poorly. On examination, the child has met all appropriate developmental milestones and appears well nourished. He has submandibular and anterior cervical lymphadenopathy. On oral examination, less than 10 lesions are visible on bilateral tonsillar pillars and soft palate with surrounding erythema. After 4 days, the lesions disappear without treatment. Which of the following is the most likely causative agent? Yes, it is Coxsackie virus A. It's important to know what the diagnosis is in this case. Okay, so the patient has sore on the back of his throat. He had fever, complaining of throat pain. In addition to that, he has less than 10 lesions that are visible on the bilateral tonsillar pillars and soft palate with surrounding erythema. Okay, after 4 days, the lesions disappear without treatment. Okay, which of the following is the most likely causative agent? So the diagnosis is herpes. Okay, when you think of Coxsackie virus, think of two very, very important diseases, particularly in the pediatric age group. One is HFMD, hand, foot, and mouth disease. The other one is herpes. If it was hand, foot, and mouth disease, as the name suggests, there would be vesicular lesions on the hand, foot, as well as the mouth. Okay, especially in the mouth, like in the oral mucosa or on the soft palate. But since hand and foot are normal, you can rule it out. But this is the very typical presentation of herpes. Okay, so a type 2 sensitivity reaction, okay, that's option A. Here they're talking about pemphigus vulgaris. So none of the specific features of that is even mentioned over here. Usually you will have very flaccid bullae, or you will have the positive Nikolsky sign. They'll definitely mention that. Okay, that is just on light pressure. Okay, basically the epidermis will get separated from the dermis. So that's very, very important sign that is seen in pemphigus vulgaris. It's also seen in a few other things. It's seen in Stevens-Johnson syndrome. It's also seen in staphylococcal scalded skin syndrome, but this is one of the signs that you have to know. Herpes simplex virus type 1, HSV1, usually causes gingivostomatitis. It can sometimes also cause vesicles on the inside the mouth, but the involvement of the tonsillar pillars is just sort of unlikely. And whenever they mention anything about tonsillar pillars, just rule out HSV because it will not affect the tonsils that much. Even the pharynx, it will sort of spare those two areas. Okay, so mostly it's only gingivostomatitis, but even if it does affect, it's restricted to the oral mucosa alone. Okay, varicella zoster, that causes chicken pox. Once again, limited to oral mucosa. Okay, so you can just rule it out. Staph aureus. Staph aureus is the causative organism of a number of dermatological conditions. Especially in children, you can think of impetigo or cellulitis. Okay, but once again, like the involvement of oral mucosa is not that much when you think of impetigo or folliculitis or anything. Okay, these usually, especially folliculitis, it affects only the hair follicles. But even in the case of impetigo, it just sort of causes honey crusted lesions on the face. Okay, so oral involvement is very, very rare. So you can just rule it out with that.
Thanks for watching. Please give a thumbs up and subscribe for more.